Good afternoon. Thank you for joining us. Yeah, I almost said good morning. It is afternoon. On behalf of the Patient Safety Authority, I'd like to welcome you to this webinar titled Keys to Investigation, Introduction to Investigative Tools. My name is Kathy Reynolds, and I'll be your moderator for the program, as well as one of our speakers. And as usual, with all of our educational offerings, we welcome comments, questions, and all materials are provided for your educational use. I also want to point out our very valued education specialist, Shelley Mikesell. Many of you may know her name. She is also supporting us, as well as our colleague, Karen McKinnon, who will be helping with the technical and access issues. So I just want to thank them for all their support. Shelley will be putting some additional resources in the chat for your access throughout the presentation. Now I'd like to introduce our speakers for the webinar. So my colleague Shirley is on with me today and will be speaking later. And Shirley, Dominic, and I are both patient safety advisors with the Patient Safety Authority. We both interact with patient safety officers and other various healthcare staff to identify safety hazards, risks, and reduce patient harm. Shirley covers facilities in the South Central region, and I cover facilities in the Southeast region. So if any of my facilities are on today, then welcome. It's good to have you here, as well as all my other colleagues, facilities, and my colleagues cover. So with that, we want to begin. And as I said today, well, first I want to set the stage a little bit, where this webinar is part of a series. So we, at the Safety Authority and the Education and Outreach team, often will have a focus for an educational offering, educational project program over a year's time, and those topics and what the focus is comes from feedback from you, meaning you, the facilities, telling us opportunities that you need more education on, opportunities that we see coming from the data, where there's real opportunities for more focus in terms of patient safety education. And we really value being able to offer opportunity to help you build capacity. This particular series that we're working on this year that started this summer is called the Keys to Investigation, or Investigation Keystone. Keystone just is what we call our these educational series. We really like to run with the Pennsylvania themes here, so hence the Keystone. So why the Safety Authority Keys to Investigation? This particular one aims to provide development for healthcare professionals within Pennsylvania healthcare facilities to improve knowledge and skills in the investigative process, invent details, investigative results, and contributory and causal factors. PSA planned education about the investigation concepts. So what are we doing? When I say education series? This has been a series of monthly webinars that I said started in August. We are, obviously this is the November webinar, and those that are checked off have already happened in the previous months. Shelley is going to populate in a link for you of a document that we call the roadmap, and it is a nice, succinct list of the webinars planned throughout this educational series, as well as the workshops that will be coming up in early spring. Those that have already passed, those webinars that have already occurred, in the description will be a link, and that link will take you to a recording of that webinar. So if you've missed those previous webinars that were, the additional topics that you see above, the links to the recording are available to you, and then the registration links for the ones that are still coming up. The recording for this webinar will be available in a few weeks as well, and that information will be shared. As I mentioned, there'll be monthly webinars throughout early 2024, and in the spring, a series of in-person workshops, like half-day workshops focusing on some of these core, more hands-on topics, process mapping, timelining, causal statements, implementation. So that's really exciting to kind of get back to doing in-person workshops or in-person events. We used to do a lot of offsite in-person events, and more information about those, the planning, locations, and stuff will be coming forth. What are the benefits? The hope is that you can improve your knowledge of investigative process and resources and use to identify causal factors, and use these findings to improve system design and patient safety at your facility. Know that a lot of these topics at this level are introductory. We have a lot of new patient safety officers, folks that are new to patient safety in general, so are really learning and kind of the basics and building from there. We always welcome, as we say, um, people that have been in the role for a while, either in patient safety, risk, quality, to join and really like that they see value in kind of refreshing or perhaps hearing new conversation that come up. So wherever you are in the process, we welcome your participation. And let's kind of move on. So what is the objectives for today? Again, this is an intro, so we're going to touch on some of those key tools that should be part of your process for your approach to any event analysis, no matter what the degree or level, but so that you can be doing a thorough analysis and not just scratching the surface. There will be in January of 24, the January webinars, I said monthly webinars, that webinar will be focusing more on some of these tool process mapping, timelining, and interviewing. So while we'll touch on them today and kind of their purpose and importance, that webinar, if there's an interest you to learn even more, like how to and what the steps are, really consider signing up for, if you haven't already, the January webinar. And then of course in the spring, some hands-on. So we'll talk a little bit like why it's important to do those thorough event analysis and not just scratch the surface. We'll talk about some of the specific tools, and we'll talk about a review and talk about available resources we have that can be used to help you complete thorough investigations. So I wanted to kind of just share a bit of a story I think that really illustrates my point in saying why it's important to do an investigation or a thorough investigation as such. And I'm sure everybody recognizes, or if you don't, this picture. It's a beautiful picture, right? It's the softly lit Lincoln Memorial in DC around twilight. It's something that maybe yourself have been able to visit at this time or spend time in DC, and a lot of people, tourists, will wait until this time of the day where the lights would go on around twilight, dusk time, where it's getting a little bit darker, but it's not dark enough that you can't continue your sightseeing. But maybe it's something you save for the end of the day because people want to get this picture. They want to get that softly lit background just as it's starting to get dark in the sky. So it's something that's really important to us, and it's something that we take care of, right? So as you can imagine, it's a venerated memorial. Something such as this is cared for by the National Park Service. There is extensive cleaning and extensive maintenance plans, and it's really an ongoing challenge because you can't just go ahead and scrub something without consideration of the age of a building or a monument such as this, the material that it's built from, the location that it's built from. This is built, I think, in the 1800s. Somebody could correct me if I'm wrong. DC at that time was also a swampy area. So it was built over an area that's kind of a tidal basin or a river, swampy, marshy area. So that kind of an environment. It's also built with porous material, marble. Marble can be eroded easily. So it's a lot of care is taken into what kind of cleaning is used on a monument such as this. And as you can imagine, that involves very many specialists, preservationists and such. So it is, while it's exposed to the elements, what kind of things could you imagine requiring extensive cleaning and maintenance? It's exposed to the elements, I was saying, dirt and grime, drops of jet fuel, car exhaust, vandalism, things that would seem to make sense. We're seeing a lot of dark, greasy spots, a lot of residue, a lot of dark residue all over, and that environmental exposure to the elements. So what would the solution to that be when we see years of grime or annually, despite annual cleaning, having dark spots and greasy spots and the like? The solution would be more cleaning, right? Because we just assume that that's environmental exposure, the things that must be what the cause is. And so therefore we'll just keep cleaning at just extensive plans. But I don't know what the prompt was to bring in a consultant, but it wasn't until a consultant, specifically an entomologist, started to look at the problem, to take a step back and say, are we sure what the cause of this erosion is, or degrading or grime is? Do we know what the cause is, or could it be something else? And let's take a look at it, and perhaps we can come up with a better solution to the actual problem. So when they looked at this, an entomologist, someone with knowledge in a particular area of insects and bugs, recognized that the residue largely was coming from a particular type of flying bug in that area called a midge. So something you would see in a swampy, marshy area, but these midges, and they leave a certain residue in areas that they swarm that is evidence of their decaying bodies or eggs, excrement. It's also a bit acidic, so it can cause damage and erosion. So while there was this assumption all this time that it was primarily environmental exposure, there was an underlying cause that was being overlooked because it hadn't been that sort of further analysis and lack of assumption of the cause was late. So these midges left that residue, as I was saying, causing decay. But here's the thing: somebody with knowledge, with expertise, understood that midges, this particular flying bug, tends to swarm at twilight, and they are very attracted to light. They love light. So if when they're out in forest, which is around this time, dusk and twilight area, and they see light, they're going to go there and they're going to hang out there. And when they got more midges, you've got more of this buildup. The solution that was suggested by the consultants and people with knowledge was turn the lights on it an hour later that you had been. And that would bypass the time where they tended to be out and would reduce the midge swarming in that area, reduce the residue, and have a great impact on the need for the cleaning that had been happening at that time. I think that's a great illustration of how we sometimes think that we understand the cause of something, and we come up with solutions and we're not really treating the underlying cause. And we may be even creating more problems because we're sort of putting band-aids on, in a sense. But in this case, by taking a step back and really looking and doing a deeper and further analysis and testing that theory, they did some tests and tried changing the lighting schedules to see, and they did see a significant reduction in the amounts with some staff to be able to actually monitor the amount and the change in the difference of bugs present at different times and what a significant change it made. So if I think that's a good just sort of illustration for you to think about of like, are we sometimes going into things making assumptions by why an event happened? Are we really taking a step back and doing a systematic approach to the event without assumptions and using the tools that we have and coming out with a very an informed knowledge of why something occurred? So I know that we talk a lot about and refer back to the air is human, but I think this quote is really relevant. But the culture of blaming versus the culture of learning, we need to move from that. And hopefully that we have moved from that. But I think we all can agree that in the world of patient safety, quality, risk, harm reduction, we always got work to do. We want to continue with this further building capacity. But the critical component of a comprehensive strategy to improve safety is to create an environment that encourages organizations to identify errors. So there's the reporting. You're identifying errors. They happen. We can count them. We're seeing them. But if we just stop there with just saying yeah, we had this many, we're not really fulfilling the need there. The important, what are we learning from them? So we can identify them, but then we have to learn from them. And how do we learn from something so that we can prevent it? So we can identify the reasons it happened, but if we're not evaluating the causes, then we're kind of stopping short. So that's really the key. It's not just the identifying, but it's the evaluation, the analysis. Healthcare is a complex, high risk industry. We know that there's a lot of intermoving parts. There's a lot of interdependent teams. There's a lot of interdisciplinary interaction. There is movement across I would say campuses, but from inpatient to outpatient services. There's opportunity, there's high risk, and there's opportunity for breakdown in these systems. So if we're not taking an approach to take a deep dive, we're going to have these underlying system breakdowns, and our defense to that is to be able to do the analysis to identify those. And what we hope to do here and hope for you as you build yourself in the role, like I said, whether you're new and learning the ropes and kind of taking these introductory courses, is thinking about what tools do you currently have on your belt. I'm sure that you're coming from, whatever your current or previous professional role has been and maybe transitioning into a new role. So you're bringing tools, you're bringing your experience. We want to help you add more tools to your tool belt. Again, we use this, get a lot of mileage out of the discussion of the Swiss cheese model, which comes from the theory of accident causation. And but it's very relevant. So in any system, and we have safety plans, we have safety design, there's successive layers of defense in the system. We may have different reviews and use of technology, and all of these um, kind of like lay as layers in that system to prevent harm from reaching a patient. But we know what we're trying to identify through analysis. And really the focus of folks like ourselves in quality, safety, risk management, patient safety is proactively identifying those breakdowns before those holes or those breakdowns, those holes in the Swiss cheese, line up in a way that that harm doesn't get blocked and it kind of gets through a layer of those defenses. Um, Failures can happen in ways what we call active failures, or those are those like on the surface. Those are, unsafe acts by people, behavioral, either decisions or mistakes. This is not, when I say active failures, it's not about intent or, directing blame towards a person. It's understanding that there's a human condition and all of us are susceptible to make mistakes, to make slips, and to sometimes make decisions. But we have to even evaluate, why did somebody make that decision that might seem to go around? Are they making an intentionally risky, dangerous choice? Or is it a workaround that's been decided because of a breakdown in the system, a lack of something in the system? What we often don't get to, what I find people, when I say scratch the surface, is they can get to the active failures. They can find out, like what was missed or what was overlooked, but not take that evaluation to the next step and really seek that underlying cause. Like they're looking for something on the surface and they're not looking for swarming bugs, if I kind of call back to a previous metaphor. So we want to, as I said, focus on those system and those latent causes in the system. When I say system, what am I talking about? So lots of times we're focused on, the person, the human being, like nurse did this, physician did this, tech did whatever. That's the surface, right? And are we looking at the system that this human being is operating in or delivering care in? When I talk about the system, what are the elements of any work system, whether that's in a hospital or really any organization, even in a home? Everything, there is a work system. So it involves the individual, the person, the human beings. We are part of the system. We are a necessary part of the system. There's also tools and technology. There's the organizational factors, policies, protocols, culture. There's the environment itself. There's the tasks, the processes, the protocols, the steps that we're taking. Think to yourself, when you are doing any kind of an event analysis, is your event analysis covering all of these areas regardless? Or do you think of it as, well, this is an equipment related event, so I'm just going to look into equipment issues? But in that equipment related event, are you also considering individual factors related that might have contributed, tools and technology factors, organization? So we can limit ourselves when we think, oh, well, we understand, we know what the cause of this is and know what we need to do, so we're just going to focus in this area from the start. Nope. For all of your analyses, do a fulsome analysis. And when I say fulsome analysis, like covering all of the elements of the system. I do understand that not every event is the same, maybe depth or format. You may have a formal, maybe longer term process of a full root cause analysis on a certain event, and something that is more of a local or an apparent cause analysis. But in any level of event, let's say, you can include attention to all of these elements. I keep mentioning or talking about the human being. So human beings, no matter what our education level, our years of experience, whether we're new in an organization and still learning the ropes, or we've been there 30 years and we really know how things work. And I did that in quotes so you can't see. Your education level, your role, your level of expertise. We are all human beings, and these characteristics apply to all of us. We all are affected by all of these conditions. So when designing safe systems, we need to compensate for these items, right? We're designing systems that support the end user, support the person that's working in them. We want people to be able to make the right decision, make it easier for them to make the right decisions, the right behavioral choices, and harder to make the wrong ones. So like forcing functions and blocking the ability for mistakes to happen. You've probably heard of human factors. The science of human factors is really studying that interrelationship between the human beings and the tools and equipment they use in the workplace and the environment in which they work. Can anybody kind of think, just to yourself, or you're welcome to share in the chat box, of examples of projects or interventions where you've sought to support the human being? The one that I can think of, I've seen facilities share, is having a do not disturb time during med pass. So it's a high risk, high tech task for a nurse, in this case, in my scenario, to be performing, but it's also a high risk area where mistakes can happen. So eliminating distractions and disturbing are approaches that organizations have taken, just as a minor example. I was saying the goal of human factors, we were talking about what human factors is, but the goal of human factors is really designing that system to make it easier to do the right thing and harder to do the wrong things. Think about, what do safe systems here? What does system design mean? Like how are we taking approach to designing either like a new process or purchasing or implementing new equipment? Even before that, on the manufacturing side, when equipment or environments are being designed, are we including how is this supporting the end user and be able to operate that particular equipment in a safe manner? I will say that all of us encounter good and bad design every day in our life, and you may not recognize it at the time. You may not know it. I think that after now thinking about it, you probably will, and start taking pictures of it, because they're great for examples when you do presentations and talking about good and bad design. But think about it, that good design is really intuitive. It's quite clear how to interact with something, and it supports you. But bad design can also, while it might not be noticed at the time, what you'll see is things like workarounds or sort of deviation from plans, where people are having to find a better way to still interact to get the work done around a poorly designed either system, equipment, whatever that may be. As I was saying, pictures, there's evidence of good and bad design everywhere. And my colleagues and I tended to snap pictures of things when we see them, because they're great for illustrating. But these are just some examples. So bad human factor design. What does one do? What does a human being do when you walk up to a door with a sign that says push, but a handle for pulling? So you have that non-intuitive use of the door. I know that I have had instances where I've, slammed into a door that had a push bar on it, but they had changed the workings of it to an electronic push plate. But the push bar, the manual push bar, was still there. So I would, almost slam into the door. To the right, I can tell you, I don't particularly know what this product thread locker does. I'll just be honest about that. But here's what I do notice is, regardless of what it does, I don't understand. It might be hard to see here with a small slide, but in the top tube, it's a red tube, and the name of the product is Thread Locker Blue. And on the bottom, it's Thread Locker Red, but the color of the tube is blue. So I don't know why Thread Locker Blue is in a red tube and why Thread Locker Red is in a blue tube. Either way, those kind of things that is going to set a human being up for failure. A picture on the right come from a colleague who recognized that the particular supermarket that they go to changed the placement of the cup holder, where it had been kind of hanging off the side and it didn't interfere with hand placement on the bars. But when that change was made, it was kind of obvious in the store. People seemed to have difficulty steering their carts, because it was like now a change all of a sudden in where people automatically used to put their hands, and they couldn't anymore because of the design change in the bar. So I think those are just some examples that maybe when you think about it now and you're out, take notice of that good and bad design, but then also think about how do we employ that in our own organizations. So before I turn it over to my colleague to talk about some of the tools and just a bit of an introduction, my point really with this early part of the presentation is that cast a wide net. If you have an assumption going in and you kind of just take a narrow path to evaluate your event, you're going to be missing perhaps the underlying causes. So cast that wide net, look at all elements of the system. And the next portion of the presentation, we'll be talking about some tools to help you do so. And with that, I will pass it on to my colleague. Oh, there we go.
Thanks so much, Kathy. I have to say that was great information. I always try to learn something new every day, and today I learned about midges. I'd never heard about that, and now I know about their environmental effects. So thank you so much for that. Good afternoon, everyone. We're now going to talk about a little bit. So this next part of the presentation kind of covers a lot of topics. And as Kathy mentioned, most of what we're going to cover is at a very high level. These things are kind of, we're just going to give some background, and then we will have a future webinar in January that's going to kind of really break these items down. As she mentioned, as things come up, if you have any questions or any comments that you'd like to make, we certainly encourage you to use the chat box, the Q&A, and then we will have a section designated at the end specifically to answer your questions. So let's start talking a little bit about some tools that are available to you. So the Patient Safety Authority has many, many tools available that are out there. And as Kathy mentioned, and part of this Keystone, that's our goal, right? We try to create educational things to kind of assist you in the jobs that you need to do every day. Some people are very experienced and they've almost created their own tools, and other people are just starting out. So we try to offer some opportunities and some tools that allow you to kind of take this information and give yourself an idea of things that you have. So this first slide that we're talking about here is talking about a root cause analysis investigation form. And what it does is it kind of gives you an opportunity to be able to systematically document what it is that you're doing. So you can see here, you're putting in the date of the event, all things that you would have already looked up, you know, when you started your analysis, maybe just a brief description of what the event is, and then kind of some other things that you can look to do as you're moving forward. So now what we're going to do is talk a little bit about event investigations and kind of look at it in two different stages. So our first stage that we're going to kind of talk about are your information gathering, right? That first part where you're just trying to figure out what the heck happened. And as Kathy mentioned, that's the time that you really want to, in the great example that she used, you want to make sure that you're going into this without any assumptions, right? You want to make sure that you're not biased to anything, and really just kind of have an open mind as you're reviewing the information as you gather it. And the second part is you're going to be analyzing, right? So you see these people, they're staring at a board, and they're kind of looking at all the pieces of information, kind of like you're putting the pieces of a puzzle together. That analysis part is going to take all the information that you gathered together and then put it together to try to determine, obviously, what happened and how you're going to move forward. So as you start your information gathering, there's several things that you may want to consider doing. You may want to start by visiting the area or department where the event occurred to assess the environment and address any immediate safety concerns, such as equipment that may have failed and that you may need to sequester. Other things that you'll want to do and consider are chart reviews and interviews, which will help you to develop a timeline of events. You will also want to do a policy review to familiarize yourself with what the current policy is, if there is one, as well as to conduct a literature search to help determine best practices. All of this is to prepare yourself to have a good base understanding of what happened. So when you're creating a timeline, you'll want to include as much information as you can obtain to help better paint a picture of what happened. Doing so can help to give an understanding of what led up to the problem and ultimately identify the problem that needs to be addressed. Think outside of the box and consider using multiple sources of information available to you, such as provider notes, lab results, imaging reports, and reports from other types of technology like smart medication dispensing cabinets, or barcode information. Note on the timeline if there are any discrepancies. For example, if the times that charted vital signs were different than what was revealed in your interviews, just make a note of that for yourself. So process mapping is a technique which is used to visually map out workflows and processes. It involves creating a process map, which also can be referred to as a flow chart, a process flow chart, or a workflow diagram. The purpose of process mapping is to communicate how a process works in a concise and straightforward manner. This helps to provide a visual representation of not only what happened, but also identify any deviations that may have occurred. This can be done by using Post-it notes on a board or a flip chart, using a swim lane diagram, or electronically with programs such as Visio. This also allows you to improve processes by identifying any potential inefficiencies or problem spots to make improvements as you brainstorm solutions. I have to say personally, when I started in patient safety, I liked the Post-it note method because I felt like as things changed, you could just pick it up and move it around. And then I would later struggle with the technology piece and put it into Visio. But I think, again, these are all ideas and things that you can consider to see what works best for you. So process maps are a widely used tool, not only in event investigation, but they also help with process improvement and quality management. So why are process maps important? They help us not only to look at what was supposed to happen, but also what happened in the event. So how do you learn really what happens? Go to the place that it happened. As I said before, one of the things you may start to is go to that department or unit where the event happened. Kind of take a walk around, look and see, watch people as they're working, kind of get an idea of how things are happening so that you understand the processes better as well. While you're there, ask people, ask them why they're doing what they're doing. Sometimes when people are always more than happy to explain things as they're doing it, they're going to be honest. They're going to tell you this is how, this is how we do this. And you may hear sometimes people say this is how we've always done it. But it's an opportunity to be in an organic environment and let people kind of tell you what's happening. Don't be afraid to ask why and challenge your assumptions. Make sure that you're fully understanding what you're talking to make sure that you understand what they're telling you or why they're doing what it is that they're doing. Make sure you talk to that frontline staff, right? Like they're the ones that are in the weeds doing this work. They're going to be able to best tell you why something is done or how it's done, or maybe even a better way to do it if they can. Don't rely solely on management or leadership, as they might not even be aware that a particular policy is not being followed. Okay, so in this picture, we have perception and reality on opposite directions of the street. Basically, this is illustrating to us that, sometimes when you're speaking to staff, you might find that what you think is actually happening, your policies, your protocols, is actually very different from what is happening. This also gives you a good opportunity to take note and consider, does the current policy in effect really reflect what is happening and make the most sense? Workarounds in healthcare refer to deviations from standard procedures that healthcare professionals use to circumvent or temporarily fix real or perceived workflow hindrances or system design flaws, or to cope with exceptional patient care circumstances. Workarounds have been around forever, and recently over the past 15 years have increased in attention, and this is corresponding to an increased focus on patient safety and evidence-based practice, as well as a rise in the use of healthcare information technologies. Workarounds have typically been viewed as deviations from best practice that put patients at risk for poor outcomes. However, this narrow view fails to take into consideration the multifactorial origins of workarounds. Workarounds can actually help you to understand workflow as it is really occurring. Oftentimes, this can be an indicator of why something happened. So interviewing. Interviewing is something that takes practice and skill. I think when I started in patient safety, it was kind of like, all right, well, you need to go interview staff. And I thought, wow, I don't really know what that indicates. I'm just going to have a conversation with some people. But the more that you do interviews, the better that you'll become. Who you interview is going to depend on the event, but you're probably going to interview several people, right? Because there are probably multiple people that were involved potentially in whatever it is that you're looking into. Another group that you may want to consider is not people of the same kind of level of staffing who weren't involved in the event, right? So you talk to the person who was involved in the event, kind of try to find out from them, what happened. But those colleagues might be able to tell you what kind of should have happened, or what is normally happening, or what do people actually do in that unit or department. Make sure that you're not placing blame or using accusatory tones or nonverbal judgment. We'll talk about this continuously, right? You want to make people feel comfortable. Sometimes people, don't even use the term interviewing because it makes people nervous. They say, we're just going to have a discussion. We want to talk about an event that occurred, right? Sometimes when you talk about interviewing and investigations, it gives people kind of the negative connotation. Consider going to the staff members, right, in their environment as opposed to having them come to your office so they don't feel like they're being summoned to the principal's office. Make sure you're asking open-ended questions and be comfortable with silence. That can be really hard. I know that was one of the hardest things for me. I'm always trying to fill those open gaps. And so when people would not say anything, I wanted to just kind of continue talking. And sometimes you have to step back and take a pause. Sometimes the questions that you're asking might be a hard question to answer. So it might take the person a little bit of time to process, or they're feeling emotional. So you have to kind of give them an opportunity. But really take that opportunity to learn that, be comfortable with that silence and how that can help you in your interviewing skills. Also be aware of nonverbal communication, how not just for the interviewee, but also for yourself. How are you presenting yourself to the person? Are you sitting close to them and listening and kind of leaning in when they're talking? Do you have your arms folded? Do you look like you're not paying attention? Are you on your cell phone, right? Like this is very emotional for many people that you're going to be talking to. And so you have to take into consideration how you are presenting yourself. How is that staff member presenting themselves? Maybe they are very quiet. Maybe they look nervous. Maybe, you need to take physical cues from that person to be able to better kind of gauge the things and how you're gonna interact. Some of the things to think about asking, right? First thing that you should be asking is, how are you doing? How are your team doing? Sometimes we don't take into consideration that this is a very upsetting time for staff members, right? They're being interviewed for something that happened. They feel that it's just emotional for them. Maybe they did make a mistake and so they feel horrible about it and they really are just nervous. They're concerned that they're gonna lose their job because they made a mistake. And so ask them how they're doing. Take some time, show some genuine concern to make sure that they're okay, because they may not be. Ask them, tell me about what happened. Let them kind of guide you through what they think happened. Tell me the process you normally follow. Let them tell you how things happened that day or to the best of their ability. And then ask them, did you deviate from what you normally do? They'll probably be able to tell you if something was going on, or if there was some kind of interruption or something that caused them to kind of deviate from what they were doing. When you're talking to, remember, you're asking who, what, when, where, why, and how. You want to kind of get all that information, obviously not in that way, but you're going to ask questions that are getting you to the answers to kind of figure out those things. Try to ask questions chronologically so you don't confuse the person. I will say this sometimes can be challenging to do because as much as you want to prepare in advance, Sometimes something that they say will be important and you kind of have to go with that information. So just be willing to be prepared, but go off script and ask additional questions if needed. Interviewing is not just about the questions that you ask, but also that the environment that you set. So when you're reviewing policies, it's important to consider several things. First, you need to find out, is there a policy? And if not, does one need to be created? Oftentimes this won't happen until you've gone through like the entire review and you figure out, okay, do we need to update this policy? If there is a policy, did what occur reflect was in the policy? When was the last time the policy reviewed? You should have processes in place that all of your policies are reviewed at some sort of frequency. But when was the last time this policy was really looked at, and do we need to update it? Or sometimes, do we need to archive it? When performing a literature search, you'll first need to determine if anything has been published on the issue. Sometimes you may find a lot of information, and sometimes there may be little or limited information. Have there been best practices established surrounding the concern? What have others experienced in this situation? And what did they implement to prevent the event from occurring again? What risk reduction strategies can your facility implement? Doing a lit search sometimes can also help to validate, like, this has happened in other places. And so what can we learn about that? And so using a lit search to find that can sometimes be really important to kind of help guide you to how you're going to respond ultimately. So what exactly does event investigation as an iterative process mean? And we have a picture of an onion there, right? So like when we talk about peeling back the layers of an onion, it's very similar to when you're conducting investigations. What this simply means is that it's a process of continuous improvement, and it's going to involve repeating the same steps over and over until the desired result is achieved. The iterative process is often used in event investigations to identify the root cause of an issue. It involves breaking down the problem into smaller parts and analyzing each part separately. This allows you to identify the root cause, but it also helps to develop solutions to prevent it from happening again. Some things that you may want to consider are additional interviews. Sometimes when you're talking to the staff that you have initially designated, you might find out that there's someone else that you need to talk to who might be able to give you some key information that you didn't think about. You may, after talking to some people, decide you need to do a further investigation of the literature to see, you might be guided by someone who might be an expert in the area that can point you in the direction of some additional literature. The other thing is look internally. What best practices do you have from other units, areas, or individuals within your facility? So now let's move on to event analysis portion. You will want to determine why something happened. A good technique to use is the 5 whys. This allows you to explore the cause and effect relationship of a particular problem you're investigating. Another step is to ask the right questions. If you ask the wrong questions, you'll get the wrong answers. Additional tools that we will review for analysis include cause and effect or fishbone diagrams. Trigger tools, gap analysis, and observations are some additional things to consider. Trigger tools are an effective method for measuring the overall level of harm from medical care in your organization. They provide an easy-to-use method for accurately identifying adverse events and measuring the rate of adverse events over time. Tracking adverse events over time is a useful way to tell if changes being made are improving the safety of care processes in your facility. The use of trigger tools is more effective than traditional efforts to detect harm, which have been focused simply on voluntary reporting and tracking of errors. Public health researchers have established that only 10 to 20% of errors are ever reported, and of those, 90 to 94% cause no harm to patients. IHI has several types of trigger tools which are available to you, and they include a general tool for measuring adverse events, and then some more specific areas. So there's one for ICU, one for outpatient services, and one for perinatal adverse events. A gap analysis in healthcare is a process of identifying gaps between current and desired performance in healthcare delivery and developing strategies to bridge these gaps. It involves examining data to determine where the gaps in care exist, and then developing materials and human resources. The optimal use of time, money, materials, and resources is perhaps more important in healthcare than in any other industry. With a myriad of fast-changing regulatory requirements and high-stake mission of saving lives, healthcare organizations must constantly strive to deliver the highest quality service while controlling costs and managing resources as effectively as possible. A great way to find out what is happening is to conduct observations. Sort of as I mentioned before, going out to those areas, departments where it hit as, and just kind of do a walk around. Talk to staff as they're working. Don't interrupt them, but just kind of watch what they're doing. This will help in a lot of reasons, but it's going to help you to better understand the workflow to really see how things are happening. Make sure that you're prepared. So asking the right questions, be prepared. After you do your initial chart review, you can start to come up with some questions that are coming up. Keep in mind, as I said before, you're going to need to be fluid and pivot should you interview someone and they give you some pertinent information that you weren't expecting. Start by asking the staff member again how they're doing, and be prepared to offer support. Make sure that you're familiar with what support is offered at your facility and provide the staff member with the information as needed. Have tissues available. It's very possible that the staff member may become emotional. Make sure you allow them the opportunity to express themselves and console as needed. Each process identified in the timeline should be looked at individually. Determine what led to the event. How did it occur? Identify processes involved in the event. Refer to your process map or timeline. Determine what happens versus what should have happened. It may be helpful to get feedback from those familiar with the process before talking to the individual who actually participated in the event. This will allow you, the interviewer, to gain a better understanding of the process prior to conducting interviews, which may be emotionally charged or challenging. Use causal factors such as tasks, processes, and policies, staff performance, training and organization, culture, communication and teamwork, environment, equipment and technology, just to name a few, to help prompt you to think about specific questions to ask. So cause and effect, I'm sure you've seen this from us many times. It's a great example of how a cause and effect diagram works. And this is a great way to start analyzing the information that you've gathered. As you can see on the slide, you're going to start on the left-hand side with your outcome. In this case, we use the example of a flashlight not working. Then move to your problem, right? What are some of the things that could be wrong? Is it the battery? Is it the bulb? It could be a switch. It could be a wiring. And then we end up with your cause at the end. And you kind of look at each one, and there might be one or multiple things that could potentially be causing that. So this is also a very useful tool for identifying the root cause of a problem and for organizing your ideas during a brainstorming session. So fishbone diagrams are something that you may have heard of that we talked about before. This is just, again, another kind of visual depiction. Some people are very visual and this is helpful to them. The fishbone diagram is also known as the Ishikawa diagram, and it's a graphical tool that's used to explore and display the possible causes of a certain effect. It's useful for identifying the root cause as well, and to help organize, again, as I said before, during your brainstorming sessions. To create this, it's very simple. You just would identify the problem that you want to analyze, draw that horizontal line across the page, and write the problem or the effect at the end of the line. So in this case, the flashlight is not working at the end of that arrow. Draw diagonal lines out this is where the fishbone comes, right? So those lines kind of make it look like fishbones there. Label each diagonal line with a category that could be contributing to the problem or effect. So things like methods, machines, people, materials, and environment are just some examples of things that you may want to consider. Brainstorm all possible causes that could be contributing to the problem or effect and write them down on the appropriate diagonal line. Analyze the diagram to identify what causes are more likely to be contributing to the problem or effect. This is an example template of the basic fishbone diagram, which can be found on the Patient Safety Authority website. By going into the patient safety topics, root cause analysis, and educational tools. This also can be done on your own in a Word document or even in Excel. The Patient Safety Authority Root Cause Analysis Educational Toolkit. Additional items that you can find to what I've just mentioned. We have our root cause analysis investigation form, which is helpful in facilitating and document the steps of a root cause analysis. The guidance document for root cause analysis form. This guide will take you step by step in how to complete the RCA form. We have an event analysis timeline, which is useful in constructing your timelines. An event analysis interview documentation form, which is helpful in tracking questions and responses from interviews you've conducted. And then there's an action agenda, and this is helpful in tracking both your implementation of improvement strategies. We also have specific event type prompts for medication, suicide, and lab events. They provide a list of questions to consider when investigating these types of events. Remember that these are not all inclusive, but they're a good starting point if you're feeling overwhelmed as to what to ask. So let's look briefly at what is a good investigation versus a bad investigation. So in a good investigation, we want to identify what happened. We want to show a direct correlation between what happened and the outcome. And we also want to look at opportunities for system improvements, and they're obvious. An example for this would be a patient fell because staff left due to an emergent call, did not ensure safe room, and call light was not within reach. Patient was unable to call for help. Now, what about a bad investigation? So bad investigations simply identify who was involved. You really can't determine how the outcome occurred. And there's really no opportunities for system improvement. And the only obvious solution is education. So an example of this is a patient fell because they didn't ask for help. So some takeaways from today. There's a lot of tools out there, right? Like we talked about a lot of things here. You need to find what works best for you and your team. Consider trying new tools. You may have learned about something new today that you're not familiar with. Be flexible, as you may need to be able to implement different tools for different events. So before we turn over to our Q&A period, Kathy, I just wanted to ask if you had anything that you wanted to add.
No, Cheryl. I mean, I think that you really covered everything well, and I don't have anything to add. I mean, I'll just share. I have had it happen to me where I was interviewing somebody for an event, and I'll just say it was a resident. I think like a first year resident or second year, like an earlier year resident. And the person became very emotional. And that moment, I'm like, oh, what did I do? Did I do something wrong? Like, did I not conduct this in the right way? There's certainly some things that I looked back on of could I done differently or better. But I think that rather than, I think being prepared that may happen, and you touched on that earlier, is kind of the important point. But I don't know that we always think ahead of time, and I advise facilities on this. Before you need it, know what resources are available, and does your facility have resources available to staff that may need support? Build that into like your event response process rather than thinking, oh, do we have something that I need now? So it's more of a preparation. Yeah. So you kind of touched on that being part of being skilled in this is knowing how to adjust or respond in the moment when the emotions arise. But also taking a lot of your advice in terms of how to set the stage and to conduct the process of an interview as well from the start.
Thanks. So as a reminder, you can find your Q&A box at the bottom of the screen. Please click on the three dots and then click on the Q&A to open the panel. Direct your questions to all panelists, and we'll be trying to answer as many questions that we can.
I also would add, as I say with anyone, even if it's not a question, if you have an example or something you think your facility does well and you want to share, or maybe an example of good or bad design that you've seen in your facility or in life in general, I'm always curious. So you're welcome to pop anything in there that you want to interact with the group with, for us or for all participants, even if it's not a question.
So it looks like we have one question that came in. How can you prevent a process mapping process from getting in the weeds? That's a great question, because I know a lot of times we always talk about going down rabbit holes, right? Like there's times when you're doing these investigations and it's like, how do you rein all that in? And as kind of the facilitator of these investigations and kind of what you're doing, like that's kind of your job, is to keep people reined in, right? But the first thing is really making sure you're setting not only objectives, but expectations, right? You have to make sure that like, what are you actually investigating? Like what is really what happened that you're looking at, and what is that process? Yeah, so just make sure that you have a start and stop to what you're doing in your process. Make sure that you kind of, as I said, rein the group in. So sometimes it's going to be your opportunity to kind of acknowledge what people are saying, but also to kind of rein back into what it is that you're looking. And you do that by, setting clear objectives and expectations of the group as you're talking. And then try to avoid going down rabbit holes, right? Like it's really easy to get caught up in abstract concepts. But when you're doing this, you really want to make sure that you have the process in place, and that you kind of know it from start to finish.
Yeah. And one thing I'll add, one way to prevent going down rabbit holes is to actually map a process. And by that, I mean, a process map is a tool, and it's intended for a purpose, to map a process. I see people, or have seen or experienced in my life, trying to do a process mapping, creating a team to do that. But the topic is not essentially a process. So you mapping a process, like what is the process from ED triage to rolling to the floor, like discharge, transfer to the floor from the ED, like that's a process. There's a stop and a start there. How can we be more transparent? How can we improve our patient safety culture? Those are not processes. Like, so trying to map that is building yourself, like setting yourself up for failure of going down the weeds, because they're abstract, conceptual. There are other better tools to tackle that challenge, like to have that brainstorm conversation. There's tons of other like facilitative ways to address an improvement effort in with that question, but you're not going to do a process map for something like that. Do you understand that? So the difference there is that's like an abstract, like concept question. The tool for that is not a process map. With a process map, you're going to be looking at a process as a start and a finish, something you can define, and then look at the processes, the sub processes, looking at what, maybe you're kind of doing in parallel, like what's supposed to happen, the kind of stated work, what's the policy say, and then really identifying from what you're peeling back those layers. What really happens? What's the true process that's happening day to day? That's a lot of what we get into in the January webinars I was mentioning, which will go more into like how to do a process map, more detail into how to do interviews and the like, and more discussion. And then again, further in the workshops, will be a bit more like opportunity to practice and hands-on case studies and stuff. So
Thanks,
I think
Kat. It looks like we have time for one more question, and we have someone asking, what do you do if someone starts crying or is visibly upset during the interview? So this is a little bit when I said before, bring tissues. I will never forget my first interview that I went on when I started in patient safety. We were kind of gathering our items, and my colleague said, make sure you grab the tissues. I thought she was joking. She's like, no, grab the tissues, you need to bring them. Well, that particular interview we went on, we didn't need them, but then she shared with me, that this was something that can happen quite frequently. And, as my first time interviewing someone, like, I didn't even think about that. But, this is really something, when we talk about that piece of being comfortable with silence, being comfortable with, someone being emotional and being able to console them however best to console them, right? So you want to offer them a tissue, give them the opportunity to express themselves. Tell them it's okay to be upset and how they're validate their feelings, and let them really just kind of tell you. Most of this, when we talked about setting the stage, getting people to trust you and to be able to open up, really, you want to make sure that you're taking every effort by asking them how they're doing, by kind of opening that door to allow them to express themselves. Let them know that this is confidential. It's not going to be, it is not something that we're going to say that, Shirley Dominic said in her interview. Like, that's not what happens. They need to feel comfortable about this as well. Kathy, anything that you want to add?
No, but I do want to just make sure we have time, looking at the time, that we, give people any closing information about CEs or anything. Okay.
Coming up, I think that was the last question anyway. So this, we will move on to the logistics here. So again, here's some resources that are available to some of the tools that we have, and were included in the chat as well as in the slides that you received, and some references for what we spoke about today. On behalf of myself, Kathy, and the entire Patient Safety Authority, we'd like to thank all of you for your interest and attendance today. As a reminder, don't forget to follow the Patient Safety Authority on all of these social media platforms for real-time updates. Don't hesitate to reach out to your advisor at any time in the future with questions you may have. Once again, thanks for attending and have a great rest of your day.